Hello, everybody. My name is Dr. Paul Thomas, and I'm a family medicine doctor. That means I take care of people of all ages and stages. I went to medical school at Wayne State University, School of Medicine. Yes. And I did my residency at Oakwood, which is now called Beaumont. And I currently practice in Southwest Detroit. My clinic is called Plum Health. Thank you. I'm here today because I believe that healthcare should be affordable and accessible for everyone. When I was invited to talk at TEDxDetroit, I was so freaking excited, man. This is awesome. Who's not having a great time today? I love sharing my story. I love talking about healthcare and Detroit and family medicine. But then I found out I'd have 8 minutes. 8 minutes! What can I possibly say in 8 minutes? You see, I'm a family medicine doctor. I like to get to know my patients. I get to talk with them for an hour. My initial appointments with them are an hour, and we get to know each other. We share stories. We develop a trusting relationship. And so this time seemed a little bit inadequate. The joy in my practice in medicine is the joy of those human relationships and those human connections. And I love my job because I really get to know the people I care for, and that's what makes it special. Being a doctor is an awesome thing. But that's not how it is in the United States. That's not how healthcare is in general across the United States. Let me tell you a little bit of a story about my grandpa Jim. Jim is a World War II veteran, and he's a retired Detroit police officer. He's also one of my best friends. I love Jim, okay? But he's got some toenail problems, okay, like you wouldn't believe. And so he went to see his primary care physician to get his toenails trimmed. And he got referred to a podiatrist. Now, the doctor made the referral because she only has 8 minutes for her patients, right? It's just not enough time to trim toenails or take care of complex medical problems. And I think we've all been there in this room, waited too long to see the doctor, only to be rushed out. And then Jim's on a fixed income, so a month later he gets a bill for $350. You see, his Medicare covers primary care, but it doesn't cover specialty care. Right, and I'm frustrated now because, man, I know my grandpa Jim, he's stubborn, right? Next time he has a problem, he's going to be reluctant to talk about it because he knows he might get a bill for it. So he told me about 6 months later about his toenails. And I'm like, why didn't you tell me sooner? I spent about 30 minutes, I trimmed his toenails, and got him back to walking, which is his favorite thing to do. And took away some of the pain that he was having because of those toenails. And that's us walking out on our street together. Okay, so I've always wanted to be a family doctor. That's a lie. I actually wanted to be a Ninja Turtle. And this is me on my 4th birthday, blowing out candles in a Ninja Turtle jumper and wishing to become a Ninja Turtle. Okay, but as I grew up, I realized that I was not an amphibian, and I needed to reevaluate my career choices. So I started volunteering in high school at a free clinic about 6 blocks from where we're sitting today. And I was working with Wayne State medical students. And I was working shoulder to shoulder with them, taking care of the most vulnerable patients in our community, the homeless, the uninsured, some elderly folks who lived across the street who this was the only clinic they could get to because they didn't have transportation. And I was so impressed by the family medicine doctor who was supervising there. He was excellent, and he could handle anything that came his way. And I wanted to be like that when I grew up. So I went to Wayne State and I became acutely aware of the health disparities in Detroit. All of these pink areas in the city of Detroit are medically underserved. There's about 100 primary care doctors for 680,000 people. That's one doctor for every 6,000 people. Okay, so we wanted to address this. We were idealistic medical students, so we built this outdoor medical clinic at the Heidelberg Project. And we're like, we're going to solve all the problems in healthcare. And it's still standing there today. It's still there today. And it represented for us the clinic that we wanted to build when we graduated from medical school and residency. But the deeper I got into my training, the more and more this dream just seemed like a dream. Like there's no way I could make it a reality. Because the further along I got in my training, I was spending less and less time with my patients. You see, being a family medicine doctor is like catching sand. You know, you've got so many people, and each grain of sand is a concern that you're trying to take care of. And it's your daughter's throat pain, it's your brother's chest pain, it's your grandfather's overgrown toenails, right? And the more patients you see, the more things kind of slip through your fingers. And that's why it's so hard to be a family doc. And I felt like the deeper I got into my training, I wasn't the doctor that I was trained to be. I just was too pressed for time. And that's when I heard about a courageous group of doctors who were living their truth, who believed what I believed, that healthcare should be affordable and accessible for everyone. They call themselves direct primary care doctors because they work directly with their patients. It's a membership model for healthcare. There's no insurance. There's no middlemen. These doctors have enough time now to be advocates for their patients. They reduced their panel from 2 to 500 members, so they see about 5 visits each day. So you get a full hour with some leftover time to make phone calls and follow up on things. That's compared to the typical family medicine doctor who has 2,400 patients and has to see about 24 patients a day. That's when those grains of sand start slipping through our fingers when we're seeing too many people each day. Currently, there are about 717 of these primary care doctors, direct primary care doctors across the country. And they advocate for their patients. They get wholesale medications, at-cost labs, at-cost imaging. They save their patients thousands of dollars each year on those ancillary services. And let me introduce you to a few of them. This is Dr. Lynn in Pittsburgh. This is Dr. Haynes in Florida. This is Dr. Flanagan in Colorado. This is Dr. Pinkney in Texas. And this is Dr. Diane Caraballo. These doctors are living their truth. They are excellent physicians who go out of the way to take care of the patients the way they should be taken care of. I'm proud to count myself among them, and I'm proud to be their colleague. Not only are they saving their patients and doing the right thing for their patients, but they may be saving the soul of medicine itself. Thank you so much for your time.